Hi, Ryan.
Hi, Tara. How are you?
Doing well. How are you? I'm so sorry. I mean, Dr. Dice.
All right. Known each other for a long time.
We have. So while people are logging on, I'll just kind of go into my introduction and then we'll bring you in for your introduction and then we'll get started. So for those of you who don't know me, or if you are new to the Nevada and California Diabetes Association, my name is Tara Winkleman. I am the Director of Programs for the Nevada and California Diabetes Association, and I myself am a type 1 diabetic. Excuse me. I've had type 1 diabetes for almost 37 years, and I've been part of, the program growing up, starting from a camper, from being 5 years old all the way up till now. Started out going to the camps, and then I was a CIT, which is a counselor in training, then counselor, camp director, and then now director of programs. So I've been around for a little bit, and I'm so happy to still be a part of the organization. So with that being said, I would like to bring in Dr. Ryan Dice. Like he just said, we have known each other for a very long time. And we wanted to kind of bring up the topic of diabetes and COVID-19 this evening. Some of you guys have had some questions come in, and we wanted to address those together. So Ryan, go ahead and introduce yourself and tell us a little bit about yourself and how you got involved with the Nevada Diabetes Association.
Thanks, Tara. So for those of you that don't know me, since I've been gone for a little while, my name's Ryan Dice. I am a pediatric endocrinology fellow at the University of Louisville in Kentucky. Yeah, way on the other side of the country. So it's a lot later here than it is there. It's like pitch black outside. But I originally got involved with the Nevada Diabetes Association as a camper, much like Tara, and grew up going to the camps and was very involved. I became a counselor and eventually became the CIT director before heading off to medical school, after which I just didn't have time to go to all the camps that I wanted to again. But after continuing through getting my education, I am just finishing up my fellowship here in Louisville and will be a full-fledged attending soon.
Wonderful. It's so great when we can put one of our own through, the steps of education. So congratulations on all your accomplishments as well.
Thank you.
So how about some basic knowledge about COVID? Can you tell us a little bit more about COVID-19? What kind of virus is it? And, where we're kind of at with it?
Absolutely. So COVID-19 is a coronavirus, which is just a type of virus, much like anything else, like a common cold, that can cause a variety of different illnesses. Most commonly, a coronavirus would cause a respiratory illness. However, COVID-19 is a specific type of strain of coronavirus, which caused obviously a much more serious effect in many adults, as opposed to other coronavirus strains, which have existed for years and years before COVID-19. And usually only cause very mild viral illnesses, kind of real similar to a common cold. But as I mentioned, this was a different strain, and COVID-19 seems to have mutated from another strain of the coronavirus. And it may have been passed along from bats, although this hasn't been thoroughly proven, but that's the leading theory at this point.
We've all kind of heard that in the media.
Yeah, absolutely. And, that's because they had seen a lot of other similar viral illnesses coming from bats in the past. And COVID-19 actually resembles a certain strain that was found in certain species of bats.
Very interesting. So we just spoke a little bit about the media just a second ago. In the news and the media, they state people with diabetes are at risk for this virus. What does that mean?
So people with diabetes aren't at any particular increased risk for getting coronavirus or COVID-19. However, they are at risk for worse complications. And this was something that we were beginning to see even from some of the patients that initially were infected in China. And then as it moved through the world, more and more individuals were able to be seen. And those that had a diagnosis of diabetes tended to have worse outcomes. However, as we all know, not all forms of diabetes are created the same, and not all diabetes is created the same, depending on how well you're taking care of it. Further analysis actually showed that those that are at the highest risk for the worst outcomes were those that were overweight and had type 2 diabetes and had poor control of their diabetes. Again, most of this was all done with adult patients and wasn't ever really studied in kids. So you can't always deduce exactly what's going to happen in children from adult studies, not just limited to COVID-19 studies, but like studies across the board. You can't just take adult data and say, oh yeah, that's going to work for kids. But in general, those that have type 1 diabetes that are children, as long as they're under relatively good control, they do not appear to be at any increased risk for poor outcomes in comparison to the peers that didn't have diabetes. There was actually just a paper that was published in November of 2020, so just a couple months ago, that said exactly that. I mean, the title of the paper was "Children and Youth with Diabetes Are Not at Increased Risk for Hospitalization Due to COVID-19." Kind of summarizes it perfectly.
Yeah, it's actually a little bit of a relief. I mean, given, you know, what we're dealing with here.
Yeah, absolutely.
So, I know a lot of us are, you know, me included, I'm a little confused. Like, what is the difference between immunocompromised and an autoimmune system? So, you know we've been hearing both of those words a lot lately too. Can you kind of explain that a little different or a little bit for us?
Yeah, absolutely. So immunocompromised means that your immune system can't respond adequately to an infection. So examples of that would be someone that is on high doses of chemotherapy, or people that just don't have working immune systems for inherited reasons. Maybe, you know, they were born without a working immune system, which can happen. Whereas autoimmune refers to your immune system actually attacking its own cells, like in type 1 diabetes. So people with type 1 diabetes or Hashimoto's, Graves' disease, by definition, have an autoimmune disease. But those with type 1 diabetes are not immunocompromised unless you have poor glycemic control or complications like DK or peripheral neuropathy or other like major issues with your blood vessels. The things that you worry about with those increased risk of infections isn't because you're immunocompromised unless you have poor circulation and poor blood flow. So if you have good glycemic control, you don't have a peripheral neuropathy, which would mean like foot disease or not being able to completely feel all the sensations, usually happens in your feet first, you shouldn't have any increased risk for getting infected.
Okay. So there's obviously a lot of different factors to take in there.
Absolutely.
So this one's kind of a two-parter question. What are the differences between all the vaccines that are available out there? We've heard words like Pfizer and Moderna. Do we know if there's any side effects, especially for those of us who are type 1, and any updates for the vaccine that is indicated for anyone under 16? I know we're kind of waiting for news on that one.
Yeah, so I guess the first thing that I would mention is kind of the last part of that question.
Okay, sure.
Both of these vaccines, the Moderna as well as the Pfizer, which those are just referred to because those are the companies that that are producing the vaccines, they did not actually have anyone enrolled that was under the age of 16. So when you're enrolling people for trials for clinical studies, you have to have your certain age cutoffs. And for both of them, it was 16 and over, or I believe they were both 16 and over. But certainly there was no one under 16. So no kids really involved. It was mostly all adults. They did take a lot of all comers with adults. There was some people that eventually got pregnant. when they were studying these vaccines. And there was certainly people that had other comorbidities as well, including diabetes, both type 1 and type 2, that were involved in these studies. That being said, the two different drugs, sorry, not drugs, but vaccines that are out there are the Moderna vaccine and the Pfizer vaccine. And like I said, those are both just the companies that happen to produce them. They're both unique because they have an mRNA vaccine, which is unlike most other vaccines that you get, like the DPAP or the MMR vaccine, your tetanus shot, things like that, aren't this type of a vaccine. And because this is kind of a special vaccine, it doesn't contain any of the live virus, and you should not be able to get COVID-19 from this vaccine. And the vaccine shouldn't ever make you test positive for COVID-19 because it isn't actually the virus. It's just a small little piece of the protein that is on the virus that then your body will mount an immune response to. And the next time it sees it, if you happen to get infected with COVID-19, your immune system will then, because you are not immunocompromised, be able to fight off that illness when it comes in. Both of the vaccine trials had a very large amount of people in them. I can tell you exactly how many they were. It was,
I love numbers.
So 43,000 participants were in the Pfizer vaccine and 30,000 for the Moderna vaccine. So that's not just like we enrolled 100 people to see what happened. They had very large numbers, which helps tell us when we're seeing things like side effects or no side effects, it lets us know they tested it on enough people to say this wasn't just by chance alone that this happened or didn't happen, which is really important when we're talking about giving someone a shot of something or trying to mass vaccinate people. So they had a lot of people in these trials. You asked about the main side effects. I have gotten actually the first vaccine, and I got this side effect. You get a sore arm. You really do. I got it in my left arm, and I will say that usually the old adage for, getting your flu shot was, oh, work the muscle, kind of make sure that you're working in the vaccine a little bit by activating the muscle. Well, I did that. I did like an arm workout right afterwards. And I will say I was sore for probably 48 hours afterwards. I was still able to use my arm. It's not like, oh my goodness, my arm was completely non-usable, but it certainly felt like I worked out a little too hard, I'll say. And I'm thinking that was all the COVID vaccine. But I didn't have any of the other side effects, which some people are now reporting with the second dose of the vaccine are happening a little bit more, like having a mild fever or having a little aches and pains and possibly even some chills as well. But those from in the studies, as well as those that I've talked to in the healthcare profession, usually last about a day and then will go away and you feel right as rain afterwards. Obviously, each person is different and individual. Some people may not get any of those symptoms at all. Some of the people may not get the sore arm like I did. Some people may get headaches or other things like that with the vaccine, but they are all transient things that should go away and are not actually a infection with the with COVID-19. But if you're getting those responses, like a fever, like you're not feeling great, that's actually probably a good thing, because that means your body is actually mounting a good immune response against that protein that it's seeing. And that means the next time it sees COVID-19, for example, hopefully once lockdowns stop and we're able to go to camp again and do things like that, see each other face to face. If you see COVID-19, you might be a little achy and something like that, but you're not going to get sick enough to where you need to go to the hospital. And hopefully our death rates and being hospitalized are going to go down tremendously with this vaccine as well. Efficacy was also shown, or how effective the vaccines were also shown in these trials. And something when I was reading through these, which was really striking to me, is that they just kind of compared how many people ended up getting COVID in one group versus the other group. And their cutoff starting time was 1 week past one of the vaccines and 2 weeks past the other one. I think it was 2 weeks past the Moderna and 1 week past the Pfizer vaccine. Then they started saying, okay, who has COVID, who doesn't have it. If you got the vaccine as opposed to just getting what's called a placebo or like a water shot, basically, you had a 95% more chance of getting COVID if you got the water shot as opposed to the vaccine. So it decreased your chance of getting COVID by 95%, which was tremendous. Like when you're looking at the numbers, when you actually look at the physical numbers of people that got COVID in one group versus the other one, it was really striking to me, and kind of showed how impressive this was working, actually.
That's amazing. Like just hearing that, kind of gives us hope a little bit. So.
Yeah, and I mean, some people have asked, and you may have seen this on the news as well, about how were they able to produce a vaccine this quickly?
Right.
It was because they had been working on this technology far before COVID-19 was even something that was considered or even known about. These type of vaccines were being looked at for the Ebola virus and for, oh, goodness gracious. Now I just blanked on it, but is common kind of in Caribbean countries more than in the United States. Dengue fever is the one that I was thinking of. But because they were already in process, all they had to do was find out what that protein was which was on the coronavirus, and insert it into this already kind of made vaccine, and see how well it worked. And it worked tremendously, which might actually help out if we ever have other viruses that pop up that are similar like this.
We say it all the time. Technology is amazing, especially, in this day and age. And just the fact that we were able to produce something so quickly just goes to show that, we're advancing and we're headed in the right direction. So,
yeah, absolutely.
You mentioned, earlier something you said, kind of like the flu shot. So will we have to take this vaccine once, or is it like a yearly dose, kind of like the flu shot?
And, that's probably the golden question. We don't know yet, because the vaccine trials, I mean, let's be honest, all of this only started about a year ago, right? I mean, all of the COVID lockdowns and us worrying about it coming over from China or from other countries only happened about a year ago. So they weren't ready to even start these vaccine trials until kind of middle of the summer. And I believe that they actually started in June or July. So we only have about 6 months worth of data of saying, hey, do these people that actually got the vaccine, can they get coronavirus later on? We don't know when the immunity is going to wane or whether it's going to wane at all. So it's possible that it could require booster shots, or it could just be a one and done situation. We're not 100% sure at this point, and it's something that the scientists are continuing to look at. Continuing to make sure they continue to check in with people and see how well it is working for those that were initially given these vaccines.
Knowledge is power. All right. So I know, we're doing this for our Renal Family Support Group and our DCAF Connection Support Group, but we also wanted to just bring this knowledge, publicly as well. I reached out to some parents, a few weeks ago and even last week, and I just asked them to kind of send me their questions. One that kept coming up was this MIS-C, which is the multi-symptom inflammatory syndrome in children. Is that, what is it? And is it even related to type 1? And what is the syndrome?
So first of all, it's not related to type 1 really at all.
Okay.
At least that we are aware of at this point. I mean, there's no data that would say children with type 1 are at increased risk to get it,
Okay.
because most children are not being hospitalized with COVID-19, thankfully. However, one of the concerning things that can happen in, it seems like children, more than anyone else, is MIS-C, which is an extremely rare condition in which different parts of the body basically just become inflamed, and it's caused by COVID-19. Most children, like I said, only get mild symptoms of COVID-19, so they don't need any advanced medical care. However, the virus can set off this, what's basically considered an excessive immune response all over the body in a very rare number of children, resulting in inflammation all over the body. So if parents are noticing, or if children are noticing that they're having really high fevers that are lasting several days, they're having diarrhea, abdominal pain, it sometimes can be really severe, kind of like appendicitis. If they're having lumps and bumps on their body, which are called swollen lymph nodes, or changes to their hands and feet where they're kind of getting a little bit puffy or maybe peeling some, they're starting to get kind of a rash all over their body, red eyes, cracked lips, and they're just feeling terrible, kind of worn out, and maybe a little bit irritable. Those are all signs that they could have MIS-C. MIS-C can also cause shock. Because everything is inflamed and your immune system's going crazy, that can make it so your blood pressure can end up going down. And because your blood pressure isn't going down, that means that you're not perfusing all of your organs and parts of your body well enough. And therefore, these children actually need to be admitted to the intensive care unit. And when they're in the intensive care unit, they're going to be really closely watched and given a lot of different drugs to help support their blood pressure and make sure that this doesn't get any worse. The current treatment for MIS-C is steroids, or something called IVIG, or intravenous immunoglobulin, which helps just kind of dampen down and calm down the immune response. It can help lower the fever, inflammation, and can really help your heart kind of return to normal, so you can make your blood pressure okay as well. Most people that are diagnosed with MIS-C do recover very well with this treatment. Steroids are also the main treatment for COVID-19 as well in adults. So that's just, kind of 2 in 1. All of that being said, again, there's nothing that I know of that relates type 1 to MIS-C. However, if someone who has diabetes gets MIS-C, they really need to be careful about what their blood sugar control is doing. Because the treatment for MIS-C is steroids, steroids we know causes elevations in blood glucose and makes it so you just don't have any insulin sensitivity. So you're going to need whopping doses of insulin, particularly around meal times, if you ever need to be placed on these steroids. And this is something that can last for even several days after going off of the steroids as well.
Okay. Well, Dr. Dice, I think we kind of covered a little bit of everything. Is there anything else you would like to add?
Obviously, coronavirus hasn't been around, or COVID-19 hasn't been around and being able to be studied for an extremely long time.
Right.
All best laid plans for doing studies in the medical field require a lot of time and for people to reproduce results. So as additional results come out, these sometimes are just one-off studies that need to be reproduced before we can absolutely say, oh yes, this is 100% what's going on. But it is something that we need to be aware of, and that there's going to be new data coming out on a regular basis. And some of that data might actually not match up with what the data was last time. Right. And that's just part of what's going to happen as we continue to gather more and more data about COVID-19. I'm sure, 5, 10 years down the road, when hopefully all of this is behind us, we'll have synthesized all this data and studied everything, and everybody will have combed through all this data really, really carefully, and we'll know, exactly who is at the highest risk and what comorbidities those were, and probably more about exactly where it came from, and how all this happened. But because this has all been happening so fast, we need time to be able to get more of that research going, because there just hasn't been enough time to look at side effects of the vaccine, and look at some of the long-term things that can happen with anything.
Absolutely. And, it's kind of like moving forward, always adapting, stuff like that.
Absolutely.
Guys, I think, Ryan, did you want to answer the question that just came in from April? Can you see it?
Yeah. So looks like April asked, will type 1s be moved up in the vaccine priority? Now, vaccines are being rolled out on a state-to-state basis, and each state has their own rollout plan. So that's all going to matter on what state you're in. Here in Kentucky, type 1s didn't seem like they were being moved to the front of the line, but that doesn't necessarily mean that's how it's going to stay, because here in Kentucky, they've only really been rolling it out to mostly healthcare workers and then the extremely elderly as well. I think in Nevada, you guys are a little bit further along than we are, but I'm not 100% aware of what the vaccine rollout is in Nevada.
And as far as I know, I think it just changed today too, as far as people who are, a little bit more at risk. I think they're starting a new plan starting today. So I think that's like literally up to date information.
And I see another question came in about the vaccine from Wen. He asked, I'm sure, will it be approved for young children, a vaccine that is? So we're still waiting on the data to come back for that. They're currently enrolling people that are younger than 16 in vaccine trials. In young children, I can't remember exactly how old the cutoff is for the current vaccine trial in children, but I know that it's going down into school-age children, not just teenagers. But I don't know if it's going to be under 5 or under 6. I can't remember exactly where that cutoff was, but they're currently doing that research. And as long as that research continues to look promising, and then there's not adverse side effects, I would assume it's going to be approved similar to the adult vaccine.
Great. Well, guys, if you guys don't have any more questions, what we can do this evening is if you think of something or you're like, oh, I wish I should have asked that, go ahead and type it down. And, Ryan can go back and see if we can get that answered for you. I just wanted to thank you for sharing your evening with us. I know it is late there, but we really appreciate it so much. And, it's great to see you again. I know we see each other very rarely nowadays, but, just everything that you can do to, we have one more. Do you have time for one more?
Yeah, absolutely. So Hallie asked, I've heard mixed information on different symptoms in type 1 diabetics, such as increase in gastrointestinal symptoms. Is there any evidence on this, or is this more like case-by-case circumstance? And I think you hit it right on the head. I think this is more of a case-by-case circumstance. I don't think there's enough information to say all people with type 1 diabetes are at increased risk for GI symptoms. I'm sure that additional data might come out eventually about those that have A1Cs that are above 10% or something of that nature might have more symptoms or worse outcomes, but we just don't have that data about particularly type 1s at this point, because they were so focused on people with diabetes and didn't stratify it into type 1 and type 2 until later on, at which point they realized, oh, kids with type 1 aren't at any increased risk. So most of the people in the child studies that I was looking at as a pediatric endocrinologist didn't have any of those more severe symptoms like GI symptoms that might require hospitalization.
All right. Well, Holly, I hope that answers the question for you. And Ryan, again, thank you so much. You know, we're very, very happy to see you. I know a lot of people have missed your face as well. So again, if there's any other questions that do come in, just go back. We'll try to get them answered for you guys. And thanks for joining us tonight. All
Absolutely.
right.
Thank you. Good to see you guys as well.
All right. Thanks, Ryan.
Stay safe, everyone.